IMA Blood Bank of Uttarakhand, serving the needs of people, providing safe blood components without replacement, not for profit. Meera Devi. She is a resident of the remote hills of Uttarakhand and is a patient of pericardial effusion and severe anemia. If it were not for the transfusion, she could have gone into cardiac failure. Thanks to the donor who gave this life-saving gift, voluntary blood donation. The process of vein-to-vein transparency starts when the donor provides brief information about himself through blood donor questionnaire and consent form. The medical history questionnaire is administered by trained medical personnel, followed by preliminary checkup that includes weight, blood pressure, pulse, temperature and hemoglobin. The donor could either get accepted or deferred. Those who are deferred are counseled appropriately. The registration is also done in the computer system. The computer system keeps a track of donor history, accepted or deferred, through high-end technology servers. The accepted donors are allotted blood bags bearing a unique barcode ID. This is the ISBT 128. The IMA Blood Bank is one of the very few blood banks in Asia registered with the ICCBBA, International Council of Communality in Blood Banking Automation. After registration, the donor is escorted to the phlebotomy area. The arm is prepared and venipuncture is performed. The blood collection monitor issues an accurate volume, is collected and is mixed with anticoagulant properly. The donor rests for a few minutes after the donation. The arm is bandaged and donor is served refreshments. The idea to keep him or her under observation for the next few minutes. In case of any adverse reaction, the medical help is available. The bag goes to a sampling station and these samples are collected in the EDTA and plain tube, and the segments are made using a dielectric sealer. These tubes and one segment would go to different labs for testing, while the rest of the segments are kept for later use at the time of cross-match. The donor details from the blood donor questionnaire and consent form are entered into the software, while the plain tubes and one segment go to the TML lab for HIV, HBV, HCV, syphilis and malaria tests. In the transfusion and microbiology lab, the barcoded tubes go onto the automated ELISA processor for testing, and the results are transferred from the robotic machine to the software directly through bidirectional interface. The EDTA tubes go to IH lab for grouping. Now, the barcoded tubes go to the automated blood grouping machine for grouping, and the results are transferred from the robotic machine to the software directly. Each whole blood unit is separated into 2 or 3 components, namely the RBC, the FFP or the RBC, FFP and platelets. The units are quarantined physically as well as in the software. There is an interactive dynamic application software which connects the donor registration, TML lab, IH lab and the component separation lab. Once testing is over, the composite labels are printed through the software. The patient request and the sample is also allocated in the unique registration ID. The cross-match is done using the latest gel card technique, and the compatibility results are entered in the software. At the time of issue, a unique issue label is generated and printed through the software to ensure that the right unit goes to the right patient. We run out of blood every now and then, and it's not an easy job to bridge the gap between the urgent need of blood for patients like Meera Devi. On a routine day, members of a motivational team have to approach various people to organize blood camps. And once that's done, the camp is scheduled and the collection team reaches the site for collection. After that, the donor registration, medical checkup, and the phlebotomy is performed at the campsite. The forms and the collected blood units are dispatched to the blood bank for further processing.